I think sizing is one of the most important visits you have, and for me, I dedicate a whole visit to it because I think that that is one of the most important things that you need to do so you can understand what the patient is looking for. Because as women, our view of what is sexy and what's going to fill out our clothes and what is going to meet with our lifestyle, are we athletes? What's our body type? Do we want to be very voluptuous? Do we want to be very modest? All those things are different for each person. And as a woman, I appreciate everyone. And so it's not really about what I want for you. It's about what you want for you and what's going to be the best choice for you. You really want to consider, what are your activities? What are you doing? Are you a marathon runner? Because if you're a marathon runner and having very, very large breasts may not be good long term. Do you want to have the ability to be at the soccer game with your kids in a tank top and have nobody know that you've had breast augmentation? And yet turn around, go out with your significant other and be in a strapless dress and have a lot of cleavage and a lot of shape, but not be committed to that look? Or do you want that very full, voluptuous look all the time? Proportion matters, and so if you take yourself out of proportion, whether it's too full or not full enough, it really begins to change the shape of your figure. And so trying to stay proportionate is really important. If you go too small up top and you're very wide in the hips, you may still give the appearance of a triangle and maybe more of a pear shape. If you go very large up top, breast-wise, and you have very narrow hips, you're going to look very full, and sometimes may even give the impression of being top-heavy and maybe even just overall body-heavy, in which case you may not be it at all. Sizing is the opportunity for you to come in and be as blunt as possible and really make sure that you're expressing what you want. And for me, I like to have patients try on implants so that they can get a sense for what they're looking for. I typically will do it in a bra that's not padded, and then have them put on a very fitted tank top. So that will give them the sense of what this is going to look like if they're braless in a tank top or if they would be in a bathing suit, so that you can see from the front view and from the side view, because they do look different. And there's cases where people are looking in the mirror and they're like, wow, that's really big, but then they turn sideways like, wow, that's not as full as I thought. I think I do want more volume. And you really want to try and get this accurate, and it's really about what you want and what you like. And my role is to guide you to find implants that fit you, to give you the look that you're looking for, but also to help balance out some of these other areas, like, are you in proportion? Is this really what you want? You are a runner. Are you going to be okay with this? You are a bodybuilder. Is this going to give you the figure that you're looking for? All of these little details I think are really important to not overlook, and the sizing appointment is the place to really drill that down.